Hello and welcome to this PARIS21 UN Women podcast. We're very glad you're here. I'm Lauren Harrison. I'm the gender lead at PARIS21. Before we start, I just wanted to take a moment to walk through a couple housekeeping items. By now, hopefully most of you should be very familiar with how webinars work on Zoom, but just in case. This webinar occurs in two parts. The first part will be moderated by Papa Sek, and there will be question and answer after the first 3 presentations. So please, we invite you to use the question and answer function in the Zoom platform. You'll find that on the toolbar. It should be on the bottom of your screen. And then we'll proceed with the second 3 presenters, and then we'll have another round of question and answer by the same mechanism, and then some closing remarks. And with that, I'll hand it off to Papa Sek for some opening remarks for our session. Thanks so much for joining.
Thank you very much, Lauren, and good morning, good afternoon, good evening to everyone. It's really a pleasure joining you. So my name is Papa Sek, and I'm UN Women's Chief Statistician. So I will moderate this first part of the webinar, as Lauren has mentioned. And just I think to kick off, I think some scene setting here. We know that the coronavirus pandemic has really been, I think, it's an understatement to say that it's been an unprecedented global crisis. And this is really adding layers to pre-existing challenges that we have in achieving the development agendas, including to achieve gender equality and women's empowerment. In addition to the human casualties that we've seen, and the socioeconomic consequences posed by the COVID-19 pandemic, we know that evidence is suggesting that the pandemic is threatening really the fragile gains that we've made on gender equality so far. And whether it is at the workplace or at home, the central roles that women are playing during this crisis is really becoming obvious. As the majority of workers in the health sector, they have been at the forefront of countries' health responses to COVID-19. At home, women's critical contributions to household well-being through unpaid work, care, and domestic work is the difference between what is a manageable crisis and what would be a total collapse of societies. This contribution is in spite of the fact that they're often paying a very heavy personal price for their efforts, including higher rates of infections for health workers, increased domestic violence, health challenges that may have severe long-term consequences. At the same time, we know that women are critical to resilience and recovery. So gender-responsive policies are needed in order to ensure that COVID-19 doesn't exacerbate existing inequalities, and to use the recovery really to build back better, as we say. And more generally, to ensure that the response is effective for women, all people, women and girls, men and boys. Leveraging our existing resources, UN Women has contributed to the global response by collecting really timely gender-sensitive data, issuing policy guidance, informing global campaigns and calls, and contributing to several interagency coordination mechanisms in the UN system. We've also, so in terms of the data production and use, we've launched a set of rapid gender assessment surveys now in almost 40 countries since March, often in partnership with governments, the private sector, UN agencies, and civil society organizations, really to provide information needed to respond with effective and informed policies. We've also teamed up with many partners, including developing and launching a COVID gender monitor just this past Friday in collaboration with the UN system. And all of these resources you will find if you visit our webpage. It's data.unwomen.org. And I really encourage you to check those resources out, because there's quite a lot of information that is available there that might be of use. So without further ado, this webinar is organized by UN Women and PARIS21, really to bring all partners together to reflect on what has been done already, what are the emerging needs and capacity barriers to deliver more and better gender data in the time of COVID-19. So the webinar will be organized in two parts. And the first one is going to focus on how to better inform governments and decision makers on the gender pandemic. And the second part will focus on how to build the current situation, to strengthen gender statistical systems moving forward. So in this first part that I will moderate, we have three speakers. First, I'll give the floor to my colleague Sarah Duerto Valero, who's the UN Women's Regional Advisor on Gender Statistics for Asia and Pacific. She has extensively worked on gender statistics and development indicators. And before joining UN Women, Sarah worked for the UN Statistics Division, UNESCAP, and UNESCO. And then after Sarah, I will give the floor to Ms. Caroline Mutwiri, who is a gender statistician at the Kenya National Bureau of Statistics, a position that she's held for the past 3 years. She has cumulative experience of 8 years in data handling. Her current job entails ensuring that gender perspectives are integrated into statistics. And last but not least, I will give the floor to Ms. Verity Morimanga, who's the current acting director for policy and research at the State Department for Gender in the Ministry of Public Services and Gender in Kenya. Verity is a demographer by profession. In her capacity as a social worker, Verity has served in various ministries, departments, and agencies in the government of Kenya. Sarah, over to you to give us a sense of what was the experience of the Asia Pacific region on the measurement of the gender effects of COVID-19 through rapid assessment surveys. Over to you, Sarah. You have 5 minutes.
Thank you, Papa. Okay. Okay, so I'm going to assume that all of you can see my screen right now. So let me start just by mentioning that this work has been going on for a bit now, but it's definitely been teamwork. So first of all, thanks a lot to my colleague Cecilia Tinonin, who has helped so much with this work, but also to all our colleagues in headquarters. It's wouldn't have been possible without all of them. So thanks for that. So I'll talk a little bit about this service. As all of you know, COVID-19 got to Asia Pacific first. Started in China, so very soon in the regional office we started wondering what are some of the consequences of this virus. Are women and men losing their jobs? Are people really spending more time teaching their children now that everybody's kind of stuck at home? Are women and men equally protected by health insurance? So these were some of the questions that popped up quite soon into our heads. So by the time the pandemic was declared, we're actually quite ready to start collecting data on this. So just 1 week later, we started our data collection. So I want to walk you through the process of the workflow a little bit of these rapid gender assessment surveys. So first, in partnership with our colleagues in headquarters, we developed a tool internally that we programmed in-house so that we could actually run all the data collection process in-house, and we didn't have to rely on any third-party provider like SurveyMonkey or Google Docs or any of that. Why? Because first of all, because our questionnaire was a little bit complex and it had many skips, so the logic was a little complicated, but also because we wanted full confidentiality of the data. So this way, we were able to achieve that. Second, and most importantly, since face-to-face data collection obviously is not possible during the current situation, we decided that we had to reach out to private sector partners to make this data collection happen. So we reached out to a number of mobile network operators across the region and asked them if they would help us disseminate this survey. And to our surprise, many of them actually said yes. So the way this works is once our data collection tool was built, we just partnered with the mobile network operators for them to send a text message to their users saying, hey, we're partnering with UN Women, please help us by filling out the survey and including the link to the survey. So when the users click on the link, they respond to the questions and the data goes directly into our server. So everybody stays in-house. And then whenever we're ready, we pull the data and we run the analysis in-house. So the whole process stays in-house, and this has provided us a lot of flexibility to move forward. What do the surveys look like? So the surveys have been run in 11 countries in Asia and the Pacific. You can see the map there. Normally we send SMS blasts to about between 1.5 and 5 million people, 5 million mobile users. And we get responses from between 1,000 and 5,000 people per country. So these samples are actually large enough to generate representative estimates. The reason why I'm saying or representatives are estimate of the people with phones, obviously, is that we have sample control. We know who's receiving the text messages. We know how many people in each country. So we're able to apply weights to adjust our samples for sex, age, and educational attainment. We also use questions that are kind of like follow international classifications so that our estimates could be somewhat compared to official statistics. And normally the data collection process takes about 1 week for collection, 1 week for analysis. In select countries where the risk was low and select areas where the risk was low, we also complemented the data collection with a face-to-face collection for some of the population groups that had less access to mobile phones. And we were only able to achieve this, again, because of the partnership, both with the private sector, but also with National Statistics Office, Ministries of Women. They have all really been instrumental to make this happen. So now obviously the survey has like 30 questions and I cannot walk you through all of the findings, but I will show you some of the key findings that struck us a little bit. So the first one, we always say that COVID-19 is affecting men disproportionately because more men are dying, but actually from a mental health perspective, it's affecting women disproportionately. So in these graphs, you can see that these are just two examples of two countries, but in most countries, women mental health had been more affected since the spread of COVID-19. Similarly, when we look at how many people got physically ill, we see that more women got ill, but this is not just from COVID, but from all other, physical illness. So this is particularly concerning because we're also seeing from the data that women are having more trouble seeing a doctor. They have to wait longer times. They're having more trouble buying medical supplies. So obviously this is all concerning. Another one of the findings that we saw quite clearly early on was that women are really bearing the burden of the increases in unpaid care and domestic work. So we're all stuck at home. So that means there's a lot of domestic workload and care workload that needs to be taken care of. So a lot of the respondents are saying that they are spending more time doing these tasks. But throughout the countries, women seem to be spending more time than men. So women are noting the increases more. When we look at the intensity of these activities, as measured by people doing at least 3 of each of those activities, we also see gender differentials in most countries, women are doing more intense work in these areas. In terms of employment, we also see important gender differentials. So what we see clearly is that in the formal sector, people are not really losing their jobs immediately. In the informal sector, yes, some people are losing their jobs, but when it comes to formal workers, people are working less paid time. So that means obviously less income from jobs. And here women are really losing out compared to men. So women are really noticing the differences quite a bit more. And finally, last finding that I want to show you is on economic resources. We see very clearly that economic resources are dwindling for everyone. But women seem to be really losing out when it comes to most of the resources, particularly remittances, properties, investments and savings, and family businesses. And the only 2 resources that seem to be kind of like on the rise for some people are government support and charity from NGOs. And even in those cases, in some countries, the people that seem to be having more access to those resources are actually men. So this is worrisome. So I think I'll leave it at this. Just generally about the surveys, for us, one of the key things that worked really well was the partnerships, again, with the private sector and with national governments, and the whole process taking place in-house so that we can have full ownership of the survey. I think those are 2 of the things that worked really well. And the things that were more of a challenge were obviously the timing, because we needed the data right away. So that meant a lot of work really quickly. And sometimes working with mobile network operators means working with people that are not statisticians. So sometimes there were difficult discussions around sampling and around, who should receive the messages, etc. And obviously limitations associated with SMS surveys and the fact that not everybody has a phone. But I'll leave it at this. I know I'm probably over time already. So I'll stop here and I'll respond to questions if you have any later on. Thank you.
Great. Thank you very much, Sarah. I now, you'll see that there are some questions in the chat. So if you don't mind just trying to address them as we go. So Caroline, perhaps now, can you tell us a little bit more about the deployment of the rapid assessment survey in Kenya, issues of coordination, collaboration and planning and design, and how different actors in the national system, statistical system were involved? Thank you. You have 5 minutes.
I'm sorry. Thank you, Papa, for the opportunity. Allow me to share my screen so that it can be easy for me to talk you guys through it. Just a minute. Okay, so as Papa mentioned, the sudden onset of the COVID-19 pandemic has greatly affected the decision makers by requiring them to have proper planning and appropriate interventions that demands access to reliable evidence and information. So this essentially means that these interventions, they need data-driven decisions that are facilitated by quality, timely and trustworthy data. But you would find out that most of these interventions, they're actually not considering, or they're considering at a very low rate, the gender impact on the pandemic. And it is very critical to understand and recognize the extent to which the pandemic affects both women and men differently. So it's against this backdrop that a rapid gender assessment study was initiated by UN Women together with its partners. And additionally, in Kenya, KNBS has and still is in the process of conducting a social economic impact on COVID-19 on households. But we felt that there was a need to conduct a rapid gender assessment on COVID-19 so as we could be able to identify the gender differentials in a more articulate manner, and also to be able to complement the survey as well that the Bureau is also undertaking. So in a nutshell, the objective of the rapid gender assessment is to assess how the livelihoods and circumstances of women and men are affected by the COVID-19. And secondly, the objective would be also to determine to what extent the pandemic has affected access to public services, which includes the schools and the health facilities. And also we are intending to provide program and policy recommendations that would also improve the social, economic, and the well-being of women, boys, men, and girls, as we also try to get the COVID-19 response and the recovery plans and interventions. So in this survey or study, the entire process for the RGA, the rapid gender assessment, will be coordinated by a number of key stakeholders who are essentially very important in closing the gap between the research production and research use. And also they'll be able to grant the project acceptance and also to provide expertise. And additionally, they would also be able to reduce or uncover risks involved in the entire process. And also not forgetting in increasing the project success. So the coordinating mechanism for this survey would involve the gender machinery, which is the State Department for Gender. We also have KNBS, where we act as the principal agency for official statistics for the government. We also have the Kenya Institute of Public Policy Research and Analysis, who are spearheading the data analysis process. And we also have the National Gender Equality Commission, who monitor, facilitate, and advise the mainstreaming of gender issues in national development. The fact that our country has two levels of government, the national and also the county government, it is essential that our statistics that are produced are able to inform the policies and programming for the county government. So that's why we also have the Council of Governors a representative in the technical committee. Additionally, we also have the UN Women, UNFPA, Oxfam, Care Kenya, and Unilever, who are offering both financial and technical support for this survey. So this coordination mechanism will essentially oversee the whole implementation of the project, starting from the goals up to the end in terms of dissemination and analysis of the data. So the objectives, as I quickly highlighted above, so this was guided by some guidelines that were sent from the UN Women headquarters that we were able to domesticate and come up with clear objectives that were relevant to Kenya. With our target respondents, being 18 years and above, and due to the pandemic, we are intending to use CATI, since face-to-face interviews are a bit difficult to carry out right now. So when it comes to sampling, collaborations in terms of sampling will happen through engaging the sampling statistician in the bureau and the CATI service providers, who will be able to make sure that the sample size will allow to draw valid conclusions from the results. Designing of the questionnaire, this was a very involving and a very interesting part, because we really benefited from the expertise from the different members of the committee. And what we did was we used a questionnaire that was designed or developed by the UNHQ, and we referenced it to what the Bureau is currently using, so that we were able to avoid duplication of efforts, and also to add some value addition to it by bringing in new questions and also bringing in new complete modules. The modules or the sections in the questionnaires incorporate the economic activities. We have the demographic characteristics. We also have the water and sanitation. There's also something on unpaid work, where we really benefited from expertise from Oxfam. We also have the health and the health care services. Also benefited from Care Kenya expertise. Gender-based violence module as well. UN Women came in handy, UNFPA, Unilever in that, and also the protection and security module, where the UNFPA were really helpful in that. So the same approach that was used to design the questionnaire was also used to design or come up with a training manual, where different members were designed in different sections for them to be able to offer their technical advice on them. So to complement the questionnaire, we also came up with an SMS-based questionnaire on the GBV module. And there's also the key informant interview that were developed by Kipra as well, which incorporates the qualitative element of it. And the programming of the questionnaire will be done by the CATI service provider. And when we come to the piloting that we planned to do, which will be done before the data collection, the full for the full survey, majorly to inform any readjustment that will be needed to the questionnaire, and also to test the programming of the questionnaire as well. And this will also be overseen by the technical committee, where the training also for the enumerators and the supervisors will also be overseen by the committee as well. So data collection will be done in 2 waves, and the analysis of the results, as I indicated earlier, and the report writing will be spearheaded by Kipra, where the survey results, once available, will be able to validate and publicly make them accessible and used by both the state and the non-state actors, which in turn will provide insights that will offer policy, program, and program recommendations as well. So in terms of timelines, that is what we had. Can quickly glance through it. As you can see, we are done with the questionnaire, we are done with the training manual, also the KIA questionnaire also, and the procurement for the CATI service providers, the MOUs also signed. Then the data collection. So we are in the process of carrying out a pilot. So we've not yet started though, but we plan for it. So this should be done by July next month, 2010, by 10th, sorry, of July. And that analysis also is planned to start the first week of August as well. So I hope I've utilized my 5 minutes properly. And that's all that I had for you for today.
Great. Thank you very much, Caroline. And there are some interesting questions on the chat, particularly, I think, with people who are asking for the resources, if that could be shared. So maybe I think once we go back to the discussions with the panel, then you can address those questions. So now I turn to Verity to tell us a little bit about the planned uses of the RGA results in Kenya's policymaking. Verity, over to you. You have 5 minutes, please. I think you're still muted. Yeah, you're still muted.
Yeah.
Okay, now.
Thank you. I'm sharing. I'm still muted. No.
No, you're good now.
No, I'm not. I've unmuted.
We can hear you.
Can you hear me?
We can hear you. Yes.
Okay.
Now we can hear.
Thank you. Yeah. So let me share my screen. Okay. Can you see my screen? So I'm going to talk about the planned uses of the of the rapid gendered assessment, and one of the things that, as Caroline has explained, the questionnaire has different sections covering different sectors. As we know, COVID-19 is a health issue, but it affects other sectors and other groups of the population. In the questionnaire, we've covered not just women, we've also covered men, women, boys, and girls, as you've heard from Caroline. And from that, the assessment, we are going to assess the impacts and trends of the virus on different population groups. So with that assessment, we should be able to plan for all the groups, including the marginalized, who are also affected differently by the pandemic. We are also going to provide a framework. The results are going to provide a framework for integration of gender issues in the whole cycle of interventions. So we are not just looking at one group, just the women, but we'll be looking at all the other groups. How are they affected by the pandemic, from prevention all the way to response mechanisms? It's also going to support efforts to prevent and respond to both the outbreak and its economic, social impacts. We know there are other impacts apart from this in the short term, in the medium term, and in the long term at both national and county levels, the two levels that Carol talked about earlier. So apart from just looking at issues at the national level, we want also to look at the issues, what is happening at the other levels of government. We are also going to ensure that accountability, it's going to ensure that there's accountability in programming. In that, integrating gender-specific indicators in the whole planning process will be used to support measurement and progress of the gender in the COVID-19 emergency response. In that, we have committees from the national level at county levels. So once the statistics or the results are provided, then they should be able to guide planning and also policy making at the different levels of government and also interventions. We are also going to have very targeted interventions from the sector-specific recommendations. Carol went through the different sectors. We have education, health, we have the security sector, we have issues to do with GBV, water sanitation. So we'll have very targeted interventions in each and every area. So the survey is going to help a lot in that area. It's also going to help us in coming up with the appropriate and effective programming and advocacy. We are doing a lot of advocacy, especially around the area of GBV and also in education, where we have home-based learning and so many issues are happening online. So there's a lot of advocacy. So all this will be the results will be very helpful because they will be informing what needs to be done in all those areas. We are going also to ensure that this planned implementation of both protection and the assistance measures in the emergency situations. So with the results, we are sure that at least what the interventions that we will be doing, they will be informed, well informed, and the policies also will be well informed. It is also going to improve effectiveness of health intervention. So we are not just looking at the pandemic from the public health point of view, we are also incorporating gender analysis into the preparedness and response efforts. And that will promote gender equality and health equity principles that we have. And that we will be seeing more sustainable and impactful outcomes because of the greater contextualization of gender and risks analysis that we'll have done, and therefore uphold the leave no one behind principle. So thank you, that's my presentation. Thank you very much for the time.
Great, thank you very much, Verity. So we have now just, I think, about I would say we're a little bit running a little bit late, but hopefully I think we can open just for some quick reactions and answers to questions. So there were quite a number of questions that were asked in the chat. So for instance, I've just shared, I think in response to a question from Eric, I've shared the global guidance that we developed at HQ that is informing some of these surveys, and in each country, of course, there is a customization of the survey instruments that is done, as Caroline has mentioned. But also, I think one important element has been really the partnerships with national statistical offices. So Sarah, perhaps I can just turn to you quickly to address some of the questions in the chat, particularly on collaboration with national statistical offices and gender ministries, for instance, that you've been engaged in. Over to you.
Thank you. Yeah, so indeed, for us, it was very important from the beginning to involve the national governments, most importantly, because we want our data to actually be relevant for national institutions and to actually be used for decision making. So the whole purpose of us collecting data is that we could inform some of the emergency responses. So the way we proceed normally is first, we reach out to all our country offices to see if there is a need in the country for this data. And we ask them to put us in touch with their national counterparts, which typically are the ministries of women. But also in our team, because we're the statistics team, we have the contacts with the National Statistics Office. So it's kind of like a two-pronged approach where we approach both of them simultaneously to see if any of them has interest and if there's a need for this data collection. So in some countries, it was right away a yes, we're very interested, please help us do this. In some other countries, it was more like, oh, actually there are many different partners already running surveys, maybe we don't need this. So in those cases, we kind of backed off. So this has been very much a kind of like a national driven process where we only run the survey in the countries that said yes, that they're interested on this kind of work. And then, of course, there's some other countries where UN Women doesn't have a country presence. But in those cases, we still reached out to either the UN country teams for their advice or directly to our counterparts in National Statistics Office, such as our colleagues in the Maldives. And we ran this. It was a very successful partnership, in my opinion.
Yeah. Great. Thanks very much, Sarah. And I'll go now to Verity. And I think there's an important question in the chat to asking about beyond just the RGAs, what other data sources are being used to support data-driven policy making. And this is, in fact, I think a question that both you, Verity, and Caroline can probably take in terms of just how on the side of KNBS you are basically, I mean, how you are informing the response on the data point of view, and for Verity, basically, what are the data sources that you are using and need essentially to inform the policy response side of things. So perhaps I'll start with Verity on, and then go to Carolina on that.
Okay, thank you, Papa, for that question. Okay, apart from the RGA, Carol talked about the socio-economic impact survey, and I think the first results were released about a month ago. It's a monthly survey, so we have that, and we are using that to back up our data. We also have, at the county levels, we have county gender officers, especially on the data on GBV. They are collecting data on a daily basis and submitting that on a weekly basis, and we are putting it on a dashboard. We are still working on the dashboard, but we have data that is coming through every week, informing on the status of GBV in the country at all levels and all types of GBV. Data, information is being reported through the county gender officers. The county gender officers at the county level, they work under the technical working groups on GBV, which comprises of stakeholders, all kinds of stakeholders. So whatever data is submitted, it is agreed upon by the various stakeholders. We also have a hotline that is used. It's a free hotline where GBV cases are being reported. We are also getting other kind of information being reported through the same line. We also have our own officers reporting through the same line and through other channels that we are getting information on. And we've also had several meetings with our partners at national level, at county levels, who are giving us feedback and also inputs on how to collect data. And they are also supplementing or complementing the data that is being provided through the State Department for Gender. And I think that's it. And we also have now participating at the national level at the National Emergency Response Committee, where we report to on gender matters. So gender issues are included from that level, from the national level, and we want to cascade it down to the counties so that we are able to capture all the data or all the information pertaining to gender under COVID-19. Thank you.
Yeah, thank you. And Caroline?
Rachel has actually answered pretty much the question very well, but probably she's just missed data from the Ministry of Health, the DHIS. Yes.
Yes. Yeah.
Thank you. Yeah, and thanks very much. And I think I think on my side, I'll just take one question that was asked in the chat from Elisa about coordination with other ongoing rapid surveys covering similar topics at country and regional and global levels. So one group that was established recently, well, not recently actually, is the Intersecretarial Working Group on Household Surveys, which includes quite a lot of most of the UN agencies that are supporting household surveys globally. And in fact, Elisa, ILO is part of it, and ILO has just shared information on some of the surveys that it is supporting. So the Intersecretarial Working Group has put together just a resource online that has compiled this information on which surveys are currently ongoing, which are being planned, and so on. And that's really, I think, one of the attempts that we have at the global level to try to coordinate more this work. There are various other groups within the UN system that are trying to also coordinate this work. Thanks. Yeah. So perhaps Lauren, I can just hand over to you for the second part.
Yes, thanks so much, Papa, and to all the panelists for a really interesting first half. I'll now invite the first panelist to turn off their video for now, and the second set of panelists to turn their videos on. Excellent. So unfortunately, due to a family emergency, one of our presenters was unable to attend today at the last moment. But we do have Liliana Sukudolska and Fatima Triaza from Maldives, and I'll just read their bios quickly for you so you know who's speaking. Liliana is a policy analyst at PARIS21, working on data governance and statistical capacity development in low and middle income countries. She is currently developing policy recommendations in the areas of strategic statistical planning and gender statistics. Fatima Triaza is the Deputy Statistician of the Maldives National Bureau of Statistics. She is currently the head of Demography and Social Statistical Division and a focal point for gender statistics. She is a member in many expert groups working in the area of social statistics, and she's authored various reports on population dynamics, poverty in the Maldives, and on other demographic characteristics. And with that, I will hand it over to Liliana for the first presentation. Thank you.
Thank you very much, Lauren. PARIS21 has been collaborating with UN Women, Women Count program for 1.5 years now to support national statistical systems in low and middle income countries to integrate gender statistics in regular data collection and communication. So more specifically, we have been collaborating with national statistical agencies and line ministries to include an increased production and dissemination of sex disaggregated and gender relevant statistics across national statistical system. And this has been done through the means of national strategies for development of statistics. So last year, for example, there was 141 countries worldwide that implemented such a strategy. PARIS21 and UN Women have been piloting the gender mainstreaming project in 7 countries so far. This has been done across all regions and including small islands and developing states. We have heard from UN Women just now in Kenya about the need for timely insights on how COVID-19 is impacting women and men differently. And it is indeed absolutely critical that these insights, as well as other gender relevant statistics, are enshrined in national policies and data collection. And this is part of our pilot. So we support countries in designing those 5 or 10 year statistical plans to include at the minimum sex disaggregated priority indicators, but also new data collections. We try to help countries better coordinate the production of gender statistics, which are cutting across all sectors: health, education, economy, environment. And we also raise awareness of policymakers. So throughout our project, we consistently saw how gender statistics were underreported, not communicated, and all but prioritized in government's actions. While some countries do have statistics laws and regulations that mandate them to produce sex disaggregated data, there are limited resources, both human and financial, as well as limited knowledge about gender issues and gender analysis. And that impedes the collection of even basic data on women and men. Closing those basic data gaps, not to even mention quality violence against women statistics, time use or asset ownership data, this has been a huge challenge for developing countries already before the crisis. And the crisis has made the field data collection very challenging. We have, for example, Kyrgyz Republic, one of our pilots, they had to cancel their population and housing census this year. So national statistical offices have extremely squeezed capacities currently. There is an enormous data demand, but very few means of data collection at hand. And looking at a broader enabling environment, a growing number of countries have gender equality policies in place that has been put in place already, but they are not accompanied by frameworks of indicators to monitor and measure progress. Also, unless gender-specific policies and indicators are really enshrined in the key policy documents like national development plans, data is often not collected. We saw that in Senegal, for example, where none of the indicators of the gender equality policies or policy was collected. And on the other hand, all gender-specific indicators that were in the national development plan, they were in place. Another question is, of course, whether these national development plans also reflect global and regional standards, including SDGs and the minimum set of gender indicators. So the crisis has only emphasized the pre-existing problems in National Statistical Office and line ministries. Above all, the isolation of statistical agencies. During the crisis, we have very often ministries of health at the forefront of data collection and communication, but very limited system-wide coordination of key data collection. National statistical offices do not communicate enough with users. There is very modest user-producer dialogue, while in time of crisis, the communication should be one of the key concerns. We have only some countries of our pilots with Maldives, for example, that had both COVID-19 dedicated data collection and corresponding regular outreach in social media. The crisis provides a great opportunity actually to pick up on communication, especially now. There's a huge potential for awareness rising. Even before COVID, PARIS21 has organized very fruitful meetings with line ministries in Egypt with participation of both men and women. And that sparked a lot of discussion on what is gender equality and why we need gender statistics. There were also great awareness raising trainings delivered by UN Women to data producing agencies, for example, in Maldives. So this dialogue with policymakers has to continue, and it's a long process. Current restriction on physical meetings can actually facilitate some of this discussion because national statistical offices planning currently long-term strategies can convene remote conferencing that can be actually sent to a wider audience who can participate in that. But of course, remote communication, it's still a challenge. In this process of expanding the communication, the leadership of national statistical offices and support from ministries in charge of women's issues, it's really key. The crisis has to be seen as an opportunity to try also new methods of data collection, including phone interviews and surveys delivered by mobile phones, which we heard of or just before. There are, of course, concerns around the application of these technologies, including ethical and privacy issues of data sensitivity and anonymity, and representation of vulnerable groups. This is especially important in the context of developing countries where we see lack of institutional mechanisms for coordination, data sharing or privacy laws. This is not there yet. So there's a great opportunity for governments to think also out of the box. Bearing in mind this do no harm principle, governments have now a chance to reach out to civil society organizations because these organizations are not only great users of data, but also important producers of gender-specific information, and they can shed new insights on key vulnerable groups. But a framework for privacy protection has to be in place. And finally, there's also a great opportunity to reopen and reprocess the data that we already have. From our pilots, we learned that there is a wealth of information, unfortunately, often sitting in a drawer, which can be used now to inform the policies of recovery. Let's take, for example, the share of informal workers broken down by sex. 70% of our pilot countries collects that data. However, in most cases, this information, as well as other insightful findings, are not all published and communicated. And I say communicated as opposed to disseminated because there has to be some recognition of who the audience is and an attempt to answer their needs. So just to recap, 2 points. A crisis is a great opportunity for governments to improve the coordination. The crisis has brought the need to close structural development data gaps, but we also need new approaches to responsible data collection and use. The crisis has emboldened the call for data governance frameworks and sustainable data stewardship in collaboration with civil society, NGOs, research, academia, private sector, and international organizations. Hence, the crisis presents an opportunity for independent national statistical agencies to chart the way for a well-governed data ecosystem with quality and credible statistics that inform the recovery. There is a need of more and more frequent communication. if there are no ways to collect new data, governments should use the data that is already there, and develop small products, try to communicate more, use different channels, including social media. Studies suggest that public communication increases citizens' trust in governments, organizations, and its policies, and because it covers valuable substantive information and simply shows that the government cares. So with this, I would like to thank you for your attention, and over to you, Lauren.
Thanks so much, Liliana. I know these, based on even what we said earlier, there's this increased momentum to generate more and better gender data now with the rapid gender data assessments, but we also want to think about how to leverage that momentum to move forward and make sure that we're setting up sustainable systems for more and better gender data in the future. So with that, I think it's a really nice connection as well to our colleague from the Maldives. Riaza, if you want to reflect a bit on how COVID-19 has shaped the landscape for gender data in your country. Over to you, Riaza, are you with us?
Yeah, thank you, Lauren,
Okay.
and thank you for the opportunity. So let me also start by sharing my screen with you all. So how NBS, the National Bureau of Statistics in Maldives, has been working during the lockdown. That's what I'll be talking about today. We have been working from home since early March, and it's like close to 3-4 months now that we have been working from home. Although the offices has been closed, our work continues in close collaboration with different line ministries and agencies. We have been actually quick to respond to COVID situation in carrying out rapid assessment with different line ministries and trying different data collection methods such as the online surveys or through the surveys delivered by the links shared by the communication partners in the country. So some of the assessments that we have done during this situation, I'm sharing right now on my screen. One is the rapid assessment survey, which we have done with the UN Women, which Sarah has highlighted. We are happy that UN Women reached out to us and we had a successful rollout of the survey in the country, and to have the findings disseminated throughout this pandemic, because the results of the survey has been used by various agencies in coming up with the different COVID responses in the country. We right now have the resort employee survey going on in the country because we had a shutdown of our tourism industry, and we are now looking at the impact it had on our resort workers. We are working with the National Emergency Operations Center, the COVID center in the country, on the analysis of COVID data, on the random testing process and data provision. The work on the analysis of COVID data, we are hoping that we might be able to have something out in the coming days for the World Population Day to have some results out. We launched a quiz on Children's Day quiz to look at how children are coping during the COVID situation, and we partnered with Ministry of Education and UNICEF, and we got some really interesting findings, useful findings, which is much needed for the Education Ministry. We used actually the Viber to pass the survey link in different ministries, in different social groups, school media groups actually, so that there is so it can be circulated among different schools. We are right now working on a proposal to study how the COVID situation has affected the informal sector in the country, and we are hoping that because the informal sector is much important for us, most of the women are working, and we would like to see how it has impacted the women, especially the work of women in the informal sector. One thing which I would like to highlight is through this new partnership and collaboration, The partnership that we have been able to form with the telecom partners in the country, who have been actually instrumental in rolling out the survey messages for us, free of cost for us actually. So the local telecom partners, Tiragu and Uridu, has been very helpful for us in rolling out these survey messages for us. So the lockdown unfortunately had an impact on the regular and planned activities for this year. One of the key activities actually included the development of the second NSDS for Maldives for 2020 to 2030. Though there has been some delays, the work is currently going on remotely. In the coming weeks, the NBS will be having virtual meetings with line ministries. The main focus actually will be to review the statistical functioning of the different ministries, what activities need to be included in the NSDS, and so and so. The development of the key national indicator is our priority, which needs to be aligned with the strategic action plan of the government, as well as with the SDG and with the different sectoral master plans in the country. In all these, the gender statistics will be taken as a cross-cutting area and will be mainstreamed across all sections. Although that we are working remotely and trying to get our work done, there are other setbacks in data collection. Our highest data collection was going on in the country, and due to COVID, we had to discontinue the data collection. The preparation for Census 2021 has taken a setback. So, but we are slowly trying to get all these planned activities carried out during the remaining months in the year. In preparation for the review of the NSDS, NBS together with Ministry of Gender and in partnership with PARIS21, we actually started on a project on establishing a gender statistical system in the country. This was a one-year project, and through this project and from the finding of the assessment, we found that there are multiple data gaps in gender statistics in the country. We are only reporting for half of the SDG indicators, and much effort needs to be placed in generating the remaining indicators, how to come up with the data collection, how administrative data can be strengthened for this purpose. So this actually highlights the importance of working towards a nationally prioritized indicators on gender statistics. Of course, then there was the capacity gaps in NBS and line ministries, which was highlighted. The lack of statistical law was addressed, and I'm happy to say that the statistical law was discussed in the parliament this week, and we are hoping to have it passed soon. Engaging political interest in statistics, like Liliana just mentioned, and the use of data for evidence-based decision-making, we still have a long way to go on that, and much work needs to be in that. I'm just highlighting this because it was this week that it was end of last week that we were able to launch the assessment of gender statistics at the first meeting we had on the interagency working group, which we held virtually. So even virtually, and we had the gender minister present there, and we got the commitment from the minister in moving forward with this work. So this is actually good news for us in moving forward with the activities that we have planned out in carrying out with the interagency working group in the country. One thing that we have learned during this pandemic is the importance of having timely, reliable statistics. So in moving forward, and I think highlighting on the findings of the report as well, we really need to invest in building administrative data for their usage in official statistics. COVID situation has also highlighted the importance of increasing the researchers in the country, especially looking at areas, how they are affecting men and women in the country. So what we saw during this COVID is many agencies, especially private parties, international organizations have carried out many researches. So there is a way we need to come up with in streamlining these researches and how these findings of rapid assessment together with the current available data can be used for in responding to the COVID recovery programs and for the recovery phase. We are actually happy to learn that these information are being used by the socio and economic response teams established by the President Office. So that's we are happy to hear that. One thing in moving forward with the partnership and increasing the use of administrative data and other data available in the country is the collaboration with the civil society organization. So we have actually started the initiation of citizen-generated data project with Maldives Red Crescent. Maldives Red Crescent is actually working in the front line to provide psychosocial support and looking into the migrant relief projects and how it is affecting the migrant population in the country. So this is again, as Liliana mentioned, a wealth of information which has been collected during the COVID situation, and we are trying to find ways how we can tap into it and work with different agencies. So of course, when carrying out these activities, NBS as the main statistical agency in the country, we have to be in a better position to have the clarity on what are the current data priorities, what we have and what we do not have, and how we can achieve during our NSDS work cycle. So this requires actually working with different sectors, building a strong and well-informed national statistical system that can respond to such pandemics. And I think, we have been quite active in responding to such data needs, requirements from different line ministries during this short time as well. So thank you. That's all from Maldives.
Thank you so much, Riaza, and for that really thorough overview of how gender statistics is progressing in the Maldives. I have a number of questions here. The first is maybe one that Liliana, you could take a start at, and then Riaza, if you want to also follow. There have been questions about innovative changes in the way surveys and data collection are carried out, and whether there's specific innovations related to gender and women's issues for data collection. And I wonder this as well, there was a earlier question also on engaging different feminist and advocacy groups on gender equality and so on. And I wonder if you could unpack a little more the work you're doing with civil society and how COVID-19 has maybe created some new opportunities as well. Over to you.
Sorry, this was to me?
Yes, sorry, Liliana, you go ahead, and then we'll let Riaza join.
Yeah, thank you very much. Yes, we see a lot of those new opportunities being picked up. We see countries moving to phone-based interviews. We see the application of mobile distributed data. So, like I said, this is really great opportunity to get new insights, but of course, bearing in mind that some groups, for example, those that don't own the mobile phone, they will be out of the scope of our study. Also, the question of privacy, of course, as I mentioned before, has to be borne in mind. We see also a lot of groups, like you said, advocating for being included in those talks about recovery. We see there's a huge enthusiasm from civil society organizations in our countries, like Riaza just mentioned in Maldives. There were very successful talks with Red Crescent from the country, and there is a lot of scope for closing some of the historic data gaps and seeing how this data could actually inform government's response. So not all countries can boast of such great collaboration, but you see emerging signs of very good partnerships. Thanks.
Thanks, Liliana. Riaza, you want to come in as well?
Yeah, I mean, one thing is that when at the start of the COVID situation, many countries actually reached out to us. Many organizations actually reached out to us, like the UN agencies, the UNFPA, UN Women, UNDP. So we partnered with the different agencies into how to streamline many of the assessments that are being carried out in the country as well. Apart from the UN agencies, government agencies also reached out to us to look at how what are the key important data that can be collected during the COVID situation, how these data can be monitored and streamlined into the regular data collecting activities carried out by the different agencies. So we have been able to provide our inputs to different organizations. We have actually partnered with not us actually, the National Emergency Operations Center reached out to us together with the Maldives National University in assisting them in doing the random sampling testing. And through that, we are trying to look at how the data that has been collected with regard to COVID situation and what are the kind of analysis that can be done from this information. So there's a lot of partnership currently going on in the country with regard to the streamlining this data collection that has been carried out in the country. And we are hoping that NBS, as the main statistical agency, can play a bigger role in such activities. I have one more question on the findings of the gender statistics assessment that we have carried out. If I may go ahead and answer that, I hope it's okay.
Yes, please.
Yeah, so the gender statistics assessment that we have carried out with PARIS21, actually, by the time that when we started with the gender assessment in the country, we did not have we were hoping that the National Development Plan for the country will come into effect, but we did not have the national plan by the time we were able to finalize the findings. So the findings of our gender statistics assessment mainly focused on the SDG data collection and on the minimum set of gender indicators coming up from these two data sets. So we looked at what are the data availabilities for the gender indicators from both of these core data sets and how much we are able to generate. At the end of the report, we actually included summary annex tables on the disaggregation by which we can have these results. So most of the SDG reporting we are right now able to do at the republic, at the urban, rural kind of level. So for the disaggregation at the rural level, a lot of work we still need to we still have to do from our side and from the line ministries, because most of these data collection are actually carried out at the national level or at the are represented at the 20 atoll levels, except for the census in the country. So the administrative data is the key hub for this reporting for the SDG as well as for the minimum set of gender indicators. So we are hoping through the interagency working group in the coming days, we might be able to work on coming up with national priority indicators and how we can have the disaggregation at the different geographical levels. So thank you.
Great. Thanks so much, Riaza, for those really insightful responses. I think we have a little bit of time for one more question, and it's a bit broad, but I'll ask Liliana if you want to reflect a little bit on how Local organizations or smaller research hubs can engage with PARIS21 in some of our activities in country. That would be excellent. And then maybe also it's a question directed to UN Women as well. I don't know if Papa, you'd like to come back in and respond a little bit to that from the UN Women side. We'd certainly welcome that as well. Liliana, over to you.
Thank you for this question. Yes, so we're really looking forward to such collaborations. PARIS21 is supporting this concept of citizen-generated data, which is data collected by civil society organizations with citizens actively providing information. So it's not like it's a sensor data or data which is passively collected about citizens. It's data that citizens actively provide for those CSOs. And there is, it's a wealth of information from grassroots organizations, and there's really a huge potential for this being used to solve data gaps that we identified in many countries. Depending on the country, it's a question of different data gaps, but very often those indicators that are needed to measure to see whether we are heading towards recovery from the crisis, they are missing, and civil society organization may actually have very good and granular data broken down by many variables, and this data can potentially inform the policies. So we try to provide clarity in terms of what this collaboration entails, both from the CSO side and from the side of national statistical system. Of course, bearing in mind that the privacy and anonymity has to be preserved. So there is lots of case studies that we could present here. We have very successful collaboration with Philippine Statistical Authority on closing data gaps in SDG reporting, and we also hope for having such a successful collaboration now in the Maldives as we move forward. Thank you.
Thanks so much, Liliana. I'm not sure if, Papa, would you like to come in really quickly from the UN Women side, connecting with local organizations and how they can get involved?
Yeah, sure. So I think one of the, in these surveys, usually, there are, I think, a few where we've actually partnered with local NGOs and to at least in the definition of what's included in the survey and so on. So I think an example is Oxfam in Kenya. We have the same in Uganda. Nigeria is also, I think, a collaboration with NGOs and so on. But more generally on citizen-generated data, our regional office in East Asia and in Eastern and Southern Africa has actually been working on a regional methodological survey on citizen-generated data and gender statistics, and with some clear recommendations on what to do and how that could be done within the region, working with CSOs. So, for instance, now we've started working with Uganda Bureau of Statistics to actually develop a local, localized guidance for CGD, and how do we get to a point where basically there's more interactions with NSOs and so on to start to define quality standards and get to a point where there can be some sort of a, if you will, I think, quality assurance framework available with developed by the NSOs and supported by the NSO. And so we've started in Uganda already. I think Ethiopia is next. So a lot of a flurry of different initiatives there that we would be able to share. So I think the report should be ready within the next few weeks or so. So it's been delayed a little bit by COVID-19, but we definitely look forward to that. And it's really, I think, an area that we're really excited about and that we will look forward to engaging in.
Great. Thanks so much, Papa. And with that, I am going to invite the executive head of PARIS21 to offer some closing remarks. Thank you all so much for your engagement with the question and answers. I've seen some requests for the the slides as well as perhaps a transcript of the Q&A, and we will see what we can do. The session is also recorded, so that will be available to you. And yes, now I'll hand it over to Johannes. Are you with us?
Yes, hello, Lauren. Good morning, good afternoon. Greetings from my house, or where I'm currently placed. So it's 25 kilometers far from the Eiffel Tower in the west of Paris. Yeah, it was a great pleasure to listen to this conversation. And I have to say, I've learned a lot. It was a great conversation and amazing panelist. So thank you so much for sharing your first-hand experience with how to deal with this crisis and what we can learn for gender data and gender statistics. I also wanted to thank our colleagues from UN Women, with whom we are having this joint project and with whom we have been organizing this webinar. And of course also for you for asking these very important questions and engaging with us, and I hope we will continue the dialogue. What I wanted to do very quickly is maybe 3 takeaways that came out from listening to the conversation. And a first sort of takeaway for me personally is we often say that the crisis is accelerating existing trends. And if we observe, if we step back for a second from the specific conversation about gender data and official data production and statistics, I think it's fair to say that we have seen over the last 10 years a really increase in interest in gender data, in sex disaggregated data. That wasn't the case 10 years ago. And my sense is that the crisis has even further accelerated this trend. Let me give you 2 examples. On the one hand, I would say that the impact of the pandemics of COVID-19 on men and women is very different, as we have heard. Lots of examples, and they are also populated in daily newspapers, how women are affected and how men are affected, adversely affected. And the issues about intimate partner violence, violence against women, has come again to the fore of the newspapers. And so in that sense, the impact of the crisis, the interest in gender data has certainly increased. Also in terms of resilience and the role of men and women in helping to deal with the crisis and helping to mitigate the impact of the crisis for the society at large, looking at elderly people, looking at children, balancing work and life. This is something that has come to the fore thanks to existing data and all the efforts that the community of global statisticians and those who collect the data have provided. So this is very good. On the other hand, and we have heard it several times, we have also seen that there is so much more appetite for data, and we have so much, and many of you have mentioned this, we still lack a lot of data, and we have to go far further in this respect. But let's take it away that this crisis has definitely raised the interest in data and statistics on gender, and that's per se a good thing, and we should continue to push for it. The second takeaway is, and it has been mentioned, I'm very glad many of you from the speakers have been mentioned this, innovation as an opportunity, and innovation, and a couple of examples just to quote what colleagues have been saying here this afternoon. Data collection. How can we innovate data collection? Looking at new forms of, we know about phone interviews, but how to do it right. We have, at PARIS21, we have started to do more web scraping to look at certain trends and analysis. But there are also other issues linked maybe more to capacity development. Some of you may know that we have, a couple of years, we started this initiative to look at capacity development 4.0. How to basically provide services, how to develop capacity in statistical offices. And we have seen with partners that just supplying, for instance, training from the outside, it will not do the trick. We have to change the way of how we do trainings. And now as sort of travel is no longer possible, and the experts, consultants can no longer fly, we see this imminent shift to other forms of providing training and services. So here, I'm very happy to tell you that we will be launching next month the PARIS21 Academy, which is already running, but we will launch a module specifically on gender communication, on gender data. So we also try as PARIS21 to adapt to this new trend. So innovation is critical, supporting statistical offices in this transformation. And the last point I wanted to mention here, which I personally find very, very interesting, is the reaching out to, as just has been mentioned, citizen-generated data to see if we can combine different data sources. There are a lot of questions to be looked at. Citizens doesn't necessarily mean better, doesn't necessarily mean at all quality, doesn't mean that citizens can be also sort of lobby groups, but to look into this, what two colleagues of mine had coined now, participatory data ecosystems. That's something I think we should look in particular in this specific part if we want to strengthen and boost gender statistics. Let me close with the last point, which is at the heart of PARIS21 work. It's strengthening of systems. I think sometimes we get all a little bit confused because many people believe that this crisis is basically a health crisis. So we basically need to collect data on health systems. I had the chance to work myself for a couple of years on health and insurance systems. So everybody is now focusing on collecting mortality dates, death rates, and issues linked to healthcare financing and protection. Well, that's all well and good, but as we all see now, as we move from protection to recovery policies, to social protection policies, it has become very clear we need data from all the different sectors. We need data on employment, we need data on governance, we need data on agriculture, we need data on infrastructure, and we need all that data ideally disaggregated and timely and accurate. So I think this push for systems, so I really do hope that this crisis will accelerate no longer the trend for looking at silos, but pushing for strengthening data ecosystems at large and mainstreaming gender statistics, for instance, in national plans, as it has been mentioned a couple of times. Now, let me really close by a plea for, we need all to lobby for development agencies to continue funding for those systems approaches. I'm a little bit worried that we might get development agencies are currently reprogramming their aid. They do focusing on COVID responses, which of course is very much in need and very much should be supported. Yet you shouldn't lose track that in particular in our field and for recovery policies to be fully comprehensive and inclusive and participatory, we also need to invest in systems, in gender, in statistical systems. And here we do hope that through the BERN network, some of you may have heard about the BERN network, is a informal get-together of development agencies and statistical interested institutions. And we do hope that through the BERN network, we can convince the community that we need to strengthen also the financing for this important work. So with this, let me close and thank again my colleagues for organizing this wonderful webinar. And let me hand over back again to Lorraine for some final words. Thank you so much.
Thanks so much, Johannes, for those reflections. Definitely well taken and lots of work to be done. I'm conscious of time. Papa wanted to come in briefly with the last remark. Papa, would you like to intervene quickly?
Yeah, just 30 seconds, and to say, you know, I couldn't agree more with what Johannes has said. I think one thing that we are learning, at least as part of the Women Count program, is that without the system, you don't do anything. So if you support the survey without having it embedded in a system, one, it becomes a one-off activity. Two, you don't get essentially the benefit of working with others that are part of the system. And three, it's not sustainable. So I couldn't agree more with you. And this is really why I think we're really excited. And energized by the collaboration that we've had with PARIS21 over the last few years. It's really been transformative in terms of the work that we've been able to do on gender statistics. And I wanted to take this opportunity really to thank you for this really useful collaboration. And just to say that we look forward to working with you in the future on these issues. But just I think one thing that I also wanted to make sure that we record before closing is that I really wanted to say thank you to all of the colleagues who are behind this and you know, who made this this webinar possible. So to Lauren, Liliana, the entire team at PARIS21, but also my own team here at UN Women, who, you know, people who are on the background. So we have Jessa, we have Jessamine Encarnacion, who we have also Sandrine, who are on the background and really who have made this possible. So thank you again for this really great webinar.
Thanks so much, Papa. And yeah, indeed, thanks to my colleagues and at UN Women for their support to make this happen. So I definitely want to thank our attendees as well for sticking with us and engaging in such a dynamic discussion. We encourage you to keep your eyes open for new materials on the UN Women Gender Data Hub, as well as on the PARIS21 Academy. And let's keep the conversation going. Thank you very much for your time, and hope to see you again at the next webinar. Thanks so much.